Hi, my name is Dr. Lucy Meier from Third Coast Foot and Ankle, and we're going to discuss today some of the less invasive ways to treat heel pain or plantar fasciitis. So plantar fasciitis is the most common cause of heel pain, which is a ligament injury on the bottom of your foot. Now, a lot of people are interested in obviously having that pain go away, but they don't want to have surgery or injections, and they're looking for less invasive ways to treat that injury. Now, there is actually a lot of different ways to treat plantar fasciitis that are very, very effective that are non-invasive. So some of the main principles of allowing that ligament to heal is to make sure that ligament is very well supported. So it's pretty common that, like, if you have a rotator cuff injury or if you have a knee injury, that you would use a brace or you would limit its use. The same concept is true when we have a ligament injury in our foot, but it doesn't necessarily mean that you have to be off of it. You don't have to be on crutches, but we just need to make sure that we're wearing appropriate shoes and then oftentimes appropriate support inside those shoes. So using something like an orthotic, sometimes an arch support, can be really effective. Now, this is different than using like a heel pad. We oftentimes are craving cushion when we have this injury, but think away from cushion and think more about support. What is going to support that ligament? There's also like compression sleeves, plantar fascia sleeves that you can wear that can give it additional support. Now, another thing that is very effective with plantar fasciitis is stretching. Now, we don't want to stretch the injured ligament on the bottom of our foot. What we actually want to do is stretch the calf muscle or the muscles that are also attaching to this injured area to help loosen up the tissue, and it can help be more effective and more timely for that ligament to heal. Now, we still have to address some of the inflammatory processes that are happening to make sure that we have an effective healing process going in. Now, it is not uncommon that you may hear people say that they get injections, that cortisone is an anti-inflammatory that is effective, but what's actually less invasive and possibly more effective and safer for you to do is something like laser therapy, where we're decreasing or managing that inflammation at a much safer way, and it's also pain-free. So this is something we really promote in our office if we're struggling with that inflammatory process and getting that inflammation and pain under control while our body is continuing to heal this injury. So if you're concerned about having plantar fasciitis and needing treatment, but you're also very concerned about having some invasive procedure being done, calm down. We can help you. There are so many different ways that we help our patients with plantar fasciitis without putting a needle in them or without surgery. So if you have additional questions, please feel free to call our practice or your local podiatrist to ask more questions. If this video was extremely helpful for you, please like it. That really helps us. And I hope to see and talk to you soon.